Today we're speaking to Margaret Jaskinska, a naturopath with Sandra Cabot's clinic, and Margaret has co-authored a book with Dr. Cabot on type 2 diabetes. Now Margaret, I hear that diabetes has become quite an epidemic worldwide and in Australia, and I was just wondering how many diabetics are there in Australia?
Well, yes, that's right, Victoria. Diabetes is actually the world's fastest growing chronic disease. There are currently around 246 million diabetics in the world, with approximately 1.5 million of those in Australia. And the interesting thing is that it's estimated that 1 in 4 Australians actually has pre-diabetes, meaning that if they do nothing to change their lifestyle or their diet, eventually they're going to develop diabetes also.
In the book that you've co-authored with Dr. Cabot, you focus on type 2 diabetes. Can you explain to everybody why this has become such a common condition?
Yeah. Diabetes is basically a disease that results in high blood sugar, commonly referred to as a lifestyle disease, because obesity, lack of exercise, poor diet are largely to blame for its increasing incidence. There are several risk factors for type 2 diabetes, and in fact a lot of them are actually under your control. Some of the risk factors for type 2 diabetes are obesity, which means being 20% or more above your ideal body weight based on your height. And you're especially at risk of type 2 diabetes if you carry a lot of your body weight around your waist, like around your middle, which in fact is most men and apple-shaped women. Another risk factor for type 2 diabetes is syndrome X, and you can be categorised as having syndrome X if you have what they call central obesity, meaning that you have the weight around your middle. So if you have a waist circumference that's greater than 80 centimetres if you're a woman and greater than 94 centimetres if you're a man, you're considered to be at risk of type 2 diabetes. You're also thought to have syndrome X if you have high blood pressure, or if you have high triglycerides, which are a type of blood fat, if you have low levels of good cholesterol in your bloodstream, that is the HDL cholesterol, and also if you have high levels of fasting blood sugar. Other risk factors for type 2 diabetes include lack of exercise, having a poor quality diet. Usually that means a diet that's high in sugar or refined carbohydrates like bread, pasta, rice, breakfast cereal, potatoes, eating a lot of vegetable oil, things like margarine or cheap cooking oils. They increase the risk of type 2 diabetes. There is a genetic component as well. We do know that because if one identical twin has type 2 diabetes, the other twin is actually 70 to 90% likely to become a type 2 diabetic themselves. Also, there are cultural and ethnic factors. Some nationalities are a lot more prone to getting type 2 diabetes than others. Certain medications increase your risk for type 2 diabetes. Things like steroids, like prednisone, use of the oral contraceptive pill can increase the risk of type 2 diabetes. Some heart medications, some diuretics, and also some medications that are used for schizophrenia or bipolar disorder.
In your book you mention that the standard recommendations for diet can actually worsen diabetes. Are you able to explain that for us, please?
Well, most type 2 diabetics are overweight, and all of them are at increased risk of heart attacks and strokes. Therefore, diabetics are told that they need to follow a low-fat diet. And they're also told that they need to eat carbohydrate foods at every meal. So carbohydrate foods like bread, pasta, rice, breakfast cereals, potatoes, because those foods don't contain any fat and they don't contain any cholesterol, so they're thought to help diabetics. Unfortunately, all carbohydrate foods are digested into sugar. Whether it's bread or pasta or just plain table sugar, they're all digested into sugar and they raise your blood sugar level. So it doesn't really matter whether the carbohydrate food is high glycemic index or low glycemic index, whether it's whole grain or refined, if it's high in fibre or low in fibre. All carbohydrate foods are digested into sugar, they raise blood sugar levels, and they also raise insulin levels. And that's the last thing that a type 2 diabetic needs, because they already have high blood sugar and they already have high insulin levels, which is what's preventing them from being able to lose weight. The most important nutrient for type 2 diabetics is actually protein, because protein won't raise blood sugar levels, and in fact protein helps to keep your blood sugar levels stable throughout the day, and that greatly reduces hunger and cravings, so it helps with weight loss. So by protein I mean foods like fish, poultry, eggs, lean meat, certain dairy products like cheese and yogurt, and there are also vegetarian sources of protein. Things like nuts, seeds, legumes. So a type 2 diabetic should really base their diet on good quality sources of protein, as well as salads, vegetables. They can eat some fruit, they can eat the nuts, seeds, legumes, and in fact our new book has got an eating plan in it specifically designed to reverse type 2 diabetes, and there are more than 40 recipes in the book.
Margaret, are there any herbs or nutrients that a diabetic is able to access to help control their blood sugars?
There are actually several beneficial herbs and nutrients for type 2 diabetics. Some of them include, there's a herb called Gymnema sylvestre. It's actually an Indian herb, and that's very good for helping to lower blood sugar and for achieving better control of blood sugar. There's also a vegetable called bitter melon. It's actually an Asian vegetable, and it looks a little bit like a blistered cucumber, but lighter in colour. You can actually find it in some supermarkets and green grocers. And bitter melon is very good at being able to control blood sugar, and you can find that in supplement form. The herb cinnamon is very beneficial also. Cinnamon helps diabetics control blood sugar. It also helps to lower insulin levels, and cinnamon also helps to lower cholesterol and triglycerides, and you can easily add cinnamon into your cooking. Another herb is fenugreek, and the seeds of fenugreek are commonly used in Indian or Thai cooking. So fenugreek is excellent for helping diabetics. It also lowers cholesterol and triglycerides, and you can find it in supplement form. You can use it in cooking. It does have quite a strong odour though, and you can also find fenugreek tea in some health food stores. When it comes to minerals, it's particularly chromium and magnesium that help with blood sugar control, and in fact a lot of diabetics are deficient in those minerals, and if they corrected that deficiency they could improve their diabetes enormously. Type 2 diabetics also have a much higher requirement for antioxidants. You see, having high blood sugar and high blood insulin levels actually creates a lot of inflammation in the body. And that inflammation creates a lot of free radicals. And those free radicals are actually responsible for many of the complications of type 2 diabetes. So diabetics require a lot higher levels of antioxidants in their diet in order to counteract those free radicals and also reduce their risk of diabetic complications.
Thank you very much for a very informative talk. You didn't mention the name of the book. Could you give it to the viewers, please?
Sure. Our upcoming book is called Diabetes Type 2, You Can Reverse It Naturally, and it will be available in stores from May.